Well, if somebody is coming to look for a dentist, one of the things that we ask them to look out for is number one, to do a little bit of background search on the dentist. Is the dentist qualification? Sometimes that's important. Does he have a higher degree? Does he specialize in, for example, in Singapore, we do have a specialist register that's been set up by the Ministry of Health, and this specialist register allows them to search who are specialists and in which fields of dentistry they are specialists in. So I think for somebody who's coming in to look for a clinic, I think the best thing is to find out who the doctors are. And we try to make it very personalized so that, we talk a little bit on where these doctors are trained, in our websites. We talk about where these people receive most of their training, where these people, what sort of experience, how many years are they being experienced, and in which particular field are they specializing in. So I would think one of the best things that somebody could look into is when they first come into the clinic, to examine the staff, how friendly the staff are, how warm the people are. It's a very service-orientated type industry, and today dentistry involves more than just being able to perform the adequate tasks, but the whole environment, the friendliness of it, the equipment has to look modern, has to look clean, has to look sterile. I think that really sets the tone for a very good clinic. So I think that is what we should be looking for when we start to search for a clinic. Usually when somebody walks into the clinic, we like them to be greeted by our staff. And because most of our clinics, patients are coming in by appointment, and because they're coming by appointment, we kind of roughly know exactly who the patient is coming in. So when they come in, we normally give them a registration form, and then we enter all this data in the computer. At the same time, in our waiting area, we do have facilities for people. If they are tired, they can sit down, they can have a drink. We have a lot of up-to-date magazines. So when people start coming into our clinic, that's how we first introduce them. And once registration is done, the staff would bring them in to tell them, Dr. ABC is going to be seeing you today. And my staff usually likes to ask them, how did they get recommended to see us? So that's forms a very important part of our whole setup. Sometimes they say friends have recommended us to see you, and then we say, and because our staff, we know the patients almost by name, everybody when they come in, and because of that, they are able to say, oh, so and so, yes, we just saw them a week ago, 2 weeks ago. Then they will start to bring the child in or the adult in to the dentist. The dentist usually greets them and tries to see what sort of personality the patient is. It could be a young child, it could be an adult. We always have in our database the type of job the person is doing, so we know whether it's this guy from the banking industry, is this guy from IT industry. And from there on, our dentists will then go in to try to relate to them more in terms of the job. So we treat them more in terms of a total person, rather than somebody that's coming in for dental treatment. We try to make it warm, friendly. And of course then the next thing we do is we ask them what is the presenting problem that makes them seek treatment with us. And then they will go in how we go, what the problem is, and the doctors will then examine them one by one and which problem, and then they will try to address the whole problem list. We usually follow that up with a diagnostic x-ray, which tells us a lot of things that are happening inside. And once we have the diagnostic x-ray and together with the clinical examination, the dentist is then able to formulate a treatment plan to the patient. And we have a lot of boards in our room whereby the dentist will actually write down in terms of whiteboard what are the steps needed for the treatment. So they try to give them a so-called comprehensive treatment right from the time they seek treatment. So patients know exactly what comes first, what comes second, what are the possible scenarios, what to expect. And I think that puts a lot of patients at rest when they know exactly what is actually going to happen. Because a lot of patients come to dentists, there's a big fear. Maybe it's a bad experience, the fear of the unknown. And we found that by telling them what to expect, it actually allays a lot of fears that happen. And this really goes in for kids as well. And people always say we can treat a kid it's much easier to treat adults because kids are harder in terms of management, especially the very young kids. This is a very interesting question because Invisalign has only come into Singapore in the year 2005. And we have quite a lot of, and we were one of the first inaugural certification whereby they certified specialists to do Invisalign. And this is where it started in Singapore. Worldwide, the country, Invisalign has been a very big company since the year 2000. Singapore embraced it in 2005. For me, if a patient comes in and would I recommend Invisalign or fixed lines, I have to first of all look at the patient. Generally for children, Invisalign is going to be a little bit difficult, especially if they have baby teeth, and sometimes we do adjustments of teeth in the baby teeth stage. And usually they are good for either teenagers who are above 13, 14 and adults. What's the advantage of Invisalign is that it's almost completely invisible. They take it out when they eat, they take it out when they brush the teeth. So in terms of eating, hygiene-wise, in the mouth, that's very easy. Fixed braces, on the other hand, they have to actually eat with the braces in the mouth. They also start to feel physical abrasions of these braces against the lip. Invisaligns are very, very thin, so they are almost like comparing contact lenses with spectacles, to put it in a layman's term. So Invisalign, they are no thicker than maybe 0.5 to 0.6 millimeters. An average brace sticks out the mouth for about 3.5 millimeters, and they are made of metal or they're made of ceramics. So I think that's where we look into the comparison. One of the biggest advantage of Invisalign is the invisibility of this all, and many patients are able to go about their normal lives with Invisalign. Okay, Invisalign, the advantage of Invisalign is it's almost invisible, very comfortable, and it's kind of like a lifestyle type appliance because patients can go about their everyday lives with this, very popular with adults. Invisalign has got this advantage as well in terms of cleaning teeth. So they take it out when they clean teeth, they brush the teeth, they take it out when they brush the teeth. So there's no real change in regime compared to a person operating brace. Invisalign has also the other advantage is that it has got a 3D computer software that allows a patient to visualize the end result of the treatment in almost any view they wanted before they started treatment. There is no other brace system that's available today in the market in Singapore that's able to show the end result before they start. So patients are very comfortable being able to see exactly what tooth movements are occurring for them to reach the desired results. So in that respect, Invisalign has got a great advantage. What are the disadvantages? To me, when I see a patient, one of the very key things that I ask a patient is that are they able to wear this for about 20 hours a day? So they virtually keep it on all the time except eating and brushing. I mean, a couple odd hours you want to take it out, that's fine, but they're practically wearing it all the time. So to me, that is the only disadvantage. A patient must be able to give me the assurance that they think they have no problems wearing it 18 to 20 hours. So a lot depends on the sort of makeup of the person. They know themselves. For parents, we have a lot of parents coming in, teenagers, and they say, oh, I want my child to wear Invisalign. I say, why is that so? How do you get to hear about Invisalign? Because a lot of this is in the media today, and their parents have worn fixed braces and they found it very uncomfortable and difficult to clean. As a result of which, they want the children to wear a premium appliance. Another big disadvantage of Invisalign is the cost. They generally cost more than fixed braces. Depending on the type of fixed braces you're going to, if you're comparing a metallic version with an Invisalign, you're talking about maybe close to 50% more fees. But if you're talking between a transparent version and Invisalign, it's probably just going to be about 20 to 30%.